Hey everyone, thanks for joining us today. I'm Xavier Harding and I'm on the content team here at Mozilla, and we have a fantastic panel planned for you today. We're talking about COVID-19 vaccine passports. So we're still in the middle of the pandemic, but things are opening back up as more and more people get the COVID-19 vaccine. This may not be like forever, but for now, public spaces are planning on checking people's vaccination status, bars, letting them into restaurants, theaters, movie theaters, etc. Vaccine passport apps offer a convenient way to quickly have a person scan a barcode and confirm their vaccination status, but there are some downsides to this convenience. That is what we are here to talk about today. Joining me is Alice Munyua. Alice is actually my coworker. Alice works here at Mozilla as the director of the Africa Innovation Program. Imogen works with the Ada Lovelace Institute as its associate director of policy. And last but not least, we have Dr. Pramod Amar Khan. Pramod is a lecturer at Postgraduate Institute of Medicine at University of Colombo in Sri Lanka. I'm excited to chat today. How are you all feeling?
Hey, good.
Yeah, great. Thanks.
Great.
Nice. Oh, actually, one last thing. I want to get to the first question, but one last thing I'll mention is that we're taking questions for this panel in real time. Tweet them at Mozilla with the hashtag dialogues and debates at Mozilla, and we can take your questions in real time. There were a lot of people on Twitter who I think had questions about this, so I have a feeling we may get one or two. So let's talk about vaccine passports. Can someone tell me just in general what a COVID vaccine passport specifically is? How is it different from prior forms of vaccination proof?
Sure. Shall I try taking that one?
Sure. Yeah.
So there's, it's a tricky area because there is a whole bundle of terms that have been used around immunity passports, vaccine passports, COVID status apps. And actually, people have been talking about this since really early on in the pandemic. We've been tracking it for the last year. To start with, there were a lot of countries thinking, could we have something like an immunity pass? If you've had COVID, you've recovered, does that mean you can go out and about, help economies moving, keep going? And some countries actually, I think, piloted that. Chile had a release pass for a few months, for example, saying if you've had COVID and you no longer have COVID, then perhaps you can move around society with a bit more confidence. After that, I think when tests came in for antibodies, there was a lot of focus around that. But really no real kind of big schemes have taken off until vaccines came on, got through regulations, started getting rolled out. And I think that's created this explosion of interest. Right now, you've got something that is scientifically sound, that can reduce risk to COVID. And there's a lot of companies, there's a lot of countries looking at whether or not you can use this as a way to reopen society more safely and to manage whatever the next phase of the pandemic looks like. So there's no kind of single or dominant model, but I guess for the purposes of this discussion, maybe there's three components you need to think about. One thing is that this is an app or a digital thing that has your health status. It might be a vaccine, proof of vaccine, it might be a test result, it might be proof of natural immunity, it might be something more dynamic or personalized, it could be a risk score, for example. But I think most models we've seen are really focusing on tests and vaccines. The second bit is that it has some identity information. It verifies that the person with that health record is the same person that's standing in front of you trying to get into a bar or trying to board a plane. And again, different models there. Some use biometrics, some are built into national identity systems, some might use identity numbers. And then the third bit, and this is the bit that I think is crucial, and this is why it isn't the same as just a, say, digital health record, is that inherent in it is the idea that someone looks at it and authorizes an individual entering a space, having a right or freedom, or blocks them from that, right? So it's a passport. It implies that somebody will permit or deny somebody doing something off the basis of their health status. And these aren't new, under international health regulations, there's been smallpox passports until that was eradicated. There's been cholera and typhus passports, which I think actually got pulled back because they didn't work. People traveled and they still caused outbreaks. So it just didn't stand up scientifically. Mm-hmm. But today, I think the only one that we've got in circulation is the yellow fever one. And I think that's the one that a lot of people will have, probably like a tatty piece of paper from like a lovely trip that you went on before the pandemic kicked off. And that actually dates back to the 30s. And what that says under international health regulation is a country cannot stop an individual entering this country because of yellow fever risk. They can, just even if they come from a country where yellow fever is rife, if they've had the vaccine, that means they are safe enough that they have to be let in, they can't be blocked. So it's just about international travel. I don't think it gets used domestically, but that's just a really like potted history of, I think, where this idea comes from.
Yeah. It sounds like there's a lot of personal information tied up in these passports. Is this similar at all to contact tracing? I know there were issues earlier in the pandemic where people were worried about contact tracing, having a lot of personal information tied up there too. How are the two different and how are the two similar? And how maybe are the worries of the two similar? Maybe we can go with Pamad for that one.
Yeah, sure. So the thing is, like, conceptually, these are two different things, like the contact tracing and the vaccine passport. But what actually happens is, like, say, for example, contact tracing is to check, like who went where and who are the people that person was in contact with. So to get this information, you need to maybe get, specifically, you need the location information, also like who are the people surrounding that particular device. But like when you talk about the vaccine passport, it's just, I mean, as Imogen mentioned, like it mainly contains this health status and the identity. But what practically can happen is, like, when governments or like countries try to produce a digital solution, most probably an app, they try to put everything together. I mean, one logic is that, like, you don't want to confuse your citizens with having multiple apps, like one for contact tracing and one for the digital passport. So they just try to bundle everything together and put that there. But the issue with that is that, like, I mean, so sometimes you just want to use this app as a digital passport, but invariably you may also have to give the app some access to track your location. So these are, I mean, in brief, these are two different concepts, but in reality, in practicality, they may come bundled together, just like in one single app.
Yeah. Oh, go ahead.
Yeah, and also the major difference here, between what, for example, the older vaccine passports that we needed, for example, the yellow fever vaccine, and this one is talking about technology solutions here. So it's, there's a lot of biometrics records, and it's tech, so it involves a lot of technology and policy decisions that need to be made that actually impact on the person and an individual differently. While previously carrying just a yellow fever certificate, which is just a paper, it's your name and whether or not you've been vaccinated against yellow fever. This one has much more information that is centralized in one space that requires technology solutions that were not used previously. So that's also the difference between what the older vaccine passports were like and what this new one, the COVID one, is being proposed. And then also, we have to know that this is super egregious because we're talking about vaccine passports here, while more than half of the world is not vaccinated or have no access to vaccines for that matter. And it's just access to vaccines, but also access to testing for COVID. So I tend to think this, it's foolhardy to be talking about vaccines here when we can't even make sure that we're equitably ensuring that people around the world, especially in poor countries, have access to this vaccine.
Yeah, you're right. I mean, it can feel like a privileged conversation to be having, where it's like, we've already been vaccinated. The hard part is over, but like, how do we make sure, no one's snooping on us? I'm glad you brought that up. I do want to talk. So you mentioned there's a lot of aspects in these passports that can be used to track you. I'm just thinking of the Twitter comments we received after announcing this dialogue and debates. A lot of people are not happy. People are like, I'm going to delete Firefox. Like, we didn't even take a stance in the tweet. We just like mentioned that we were having this discussion. But I want to put aside like the tech angle of vaccine passports, even analog vaccine passports. Alice, do you want to talk a little bit about how that can be kind of fraught as well?
Yeah, I mean, look, I mean, I'm Kenyan, and as an African who, I have to show evidence of multiple vaccinations, not just at the point of entry in terms of travel, but at every visa application stage, yellow fever. And I believe the same here in the United States, even going to, I think going to a public school, you have to show evidence of vaccination. But I mean, I still hold the opinion that the best way to save millions of lives around the world and reopen, the capitalist economies, that's what we're talking about, is to distribute vaccines fairly. But one issue that's going to come up is when you're mandating vaccine passports, for example, for travel, it introduces new challenges. International laws allows countries to require visitors proof that they have been vaccinated, for example, around yellow fever, but coronavirus is new and those haven't really been authorized for use around the world. And some countries might actually decide to accept evidence of only vaccines that have been approved within their borders. For example, EU countries might just say, we only are going to accept vaccines that people vaccinated with vaccines that we've approved. China has already done that, and so without international consensus, I think we risk entrenching these geopolitical divides with inconsistent requirements that are definitely going to be prolonging the pandemic and, in fact, prolonging re-entry into the so-called normal life. I ventured to say that actually vaccine passports, for me, in my opinion, are examples of another crisis response that's seeking to depend on technology, yet another instance of trying to rapidly respond to really complex human problems by, again, reaching to identity and surveillance systems, just like we saw with 9/11. And as long as access to vaccines, even the vaccines themselves and the vaccine passports are limited to people in countries that have adequate vaccine. The majority of the countries that don't have sufficient supplies of this are going to be excluded. Yeah. And so, and continue entrenching this tiering of, globally that has existed anyway. But what we're going to be doing is perpetuating it, perhaps maybe unintentionally, but continuously perpetuating it as well.
That's such a strong point. I mean, like the tiered society, it's kind of like a lot of the things we talk about here in Mozilla Foundation and how bias in artificial intelligence kind of makes existing biases kind of new again and stronger, just because it kind of reinforces the word I'm looking for. I can think of the word reinforces. It's unfortunate to see what you mentioned, Lev, like passports have the potential to reinforce the already existing tiered society.
Yeah, discrimination, exclusion pattern, and stigmatization, and health issues actually carry a lot of stigma. And I really have the feeling that for as long as poor countries don't have access to vaccines, soon this is going to be considered either, COVID is going to be looked at as a poor person's problem or disease. And as usual, guess which parts of the world are going to suffer? The African continent, South America, Asia, those ones that haven't been able to vaccinate their people. So again, reinforcing the same old patterns of discrimination and exclusion. So we need to take this a little bit more seriously. And also look within the context of the digital identity industry, because I think you can't separate the two, because if you look at the people that are really pushing for this so-called COVID vaccine are the same people that are pushing for digital ID. So you can't separate those two discussions. And when you look at, and most of the companies and firms that are pushing for it because there's a monetary issue there. There's a profit issue there. So it's not about people again, it's about where can we, get as much profit as possible. And that's the same discussion we're seeing when it comes to equitable access to the vaccine itself.
Yeah, I mean, when profit is the main motive as opposed to like keeping people safe and healthy and like keeping things fair, it's kind of scary. This talk right now is reminding me, so in New York where I am right now, we're privileged right now, like I have my first shot of the vaccine. People who are above 30, people who are adults are able to get the shot fairly easily for free. And we also have the Excelsior app. The Excelsior app is the New York COVID passport app. I'm looking at the reviews of the app. One of them mentions, I have an older iPhone 6, so I'm unable to update to iOS 13. Therefore, I can't use this app, and neither can thousands of other New Yorkers with other iPhones. The title of the review is only for the wealthy, I guess. Dr. Pamad, I want to talk to you a little bit about like the various technological options when it comes to COVID passport apps? Is there some kind of segmentation there? Because it's kind of confusing just how many there are worldwide.
Yeah, it's a very good point that you raised. So the thing is, there is some interesting document that was published as a release candidate one by the WHO, I think on March 21st. So it's the WHO, World Health Organization guidelines on, they call it SVC, that is a smart vaccine certificate. So in this one, it's really interesting to see that they have some guiding principles, especially to address the issues that we discussed a while ago. So there are 4 guiding principles that they base this document on. So they emphasizes the equity and protection of the person's privacy and the accessibility of this solution to the people in the country, and also about the scalability. So it's also interesting to note that in this document, when they talk about the smart vaccination certificate, they mention there can be 2 options. So the first one is the one that comes to us, invariably, which is like we are thinking of some techie solution like a mobile app, which has all this information about my health status, identity, and maybe a QR code or barcode or something like that, which has all this embedded together. So that's one. And in fact, they also mentioned about the other concept, which is called, they call it as a digital twin. So what this digital twin means, like you have the paper-based document and you create some linkage between the paper-based document and another digital certificate, a digital solution. For example, you can print up, you can have the normal vaccination card that you have everywhere in the world, and you may be able to print a QR code or something where you have that information maybe encrypted. So it is accessible through a digital solution. So with that, so what they're advising is, especially in the countries, the developing countries in the global south, when they are trying to deploy these implementations, we have very less capacity, less infrastructure, and maybe we don't have that much of financial support to implement these solutions, to go with this digital twin option. So you have the paper certificate on which you can have some linkage between that paper document and the digital system. So with that, that's exactly what we are trying to do especially I'm working in Sri Lanka. So this is what we actually trying to do. We try to issue this, the paper certificate to everyone, but like whoever who has access, if they want to travel abroad, they have the access to this app or the citizen portal, we call it, online access to the vaccination and health information. So with that, we try to minimize this, the equity issue or the accessibility issue to the technology that everyone may be having.
Yeah. I want to stay here for a bit because I think, a lot of what I've been hearing over in my little New York bubble, a lot of the vaccine passport conversation tends to focus on the US and UK. What do you think folks having this conversation when they center around the US, UK, what do you think they're missing when they tend to talk about these things?
Yeah. The thing is this, now we may feel that it's mostly the countries in the global north who have access to the latest technology, but things are changing. Like the countries in Africa, Asia, and the poorest countries also have some access to, at least they try to implement so many digital solutions. That's what we have seen in the last couple of decades. So I like to highlight one interesting point. So in Sri Lanka, what we did, so we got our first case of COVID-19 in last week of January 2020. But we, over the last 5 or 6 years, we have been building our capacity within the Ministry of Health and the entire country around open solutions. So we are using this open source solution called DHIS2. It's a free and open source health management information system, which is currently used in more than 70 countries at national level. So what we try to do is just within 1 week of time, we were able to set up something very generic for port of entry monitoring based on this platform. And we did not actually stop there. What we did was this platform, the open source platform, has a very large open source community. So we shared our metadata with the community, and we have a core development team in the University of Oslo. So they kind of make it generic. So all these countries who are using these open source solutions, they just had to install that metadata, and they had this entire package available for them to use. Similarly, for the vaccine passport, or we call it vaccination certificate, we are using another open source solution called Divox. So we have created integration between these 2 open source solutions, so that, the way we see it is our countries are not having resources and we are lacking capacity. So that way we have identified relying ourselves more on open source solutions, which has a good support, of course, is a way forward. So that's one common approach that has been happening in most of these developing countries.
Yeah, that's great. Imogen, could you talk a little bit about the research you've been doing at Ada Lovelace? I remember hearing yesterday, it was pretty fascinating.
Yeah, sure. So we've been, as I said, we've been monitoring the kind of evolution of COVID tech tools over the last year, but we really ramped up the work on vaccine passports over the last few months. And we brought together a group of really amazing experts from immunology, from epidemiology, from sociology and behavioral science, international development, law, history, public health, identity systems, this like really rich array of experts around this topic to deliberate on the question really of what place, if any, should vaccine passports have in society. And, I'll just pull out a few points. I think all acknowledge the attraction of these tools, see why countries are thinking, particularly in the midst of a lockdown, can we have a more granular understanding of risk? Can we be more targeted in our interventions? Can we start to open up society, get economies moving? And it's worth saying it's not just about kind of economy versus society or economy versus health, right? Some of this is about, in the UK, people in care homes haven't been able to see their family for a long time. Is there a way that for some of those really vulnerable groups, you can have a more granular understanding of risk? You can really see the attractions, I think, there. But I think the consensus the group came to was that there were just real concerns about any rollout at present. And I think there's one piece which is really the scientific bedrock of this, right? You can't build the tech unless it has sure scientific foundations. And it feels like the real justification for something like a COVID status app or a vaccine passport is that if I have to tell you something about my health, it's because my health tells you something about your risk, right? So it's about the transmission. It's not just about the risk I face from COVID, it's about the risk I pose to you. And that's the justification for me having to disclose that information. And at the moment, we've got really amazing evidence about, vaccine protecting individuals. What we don't have is a clear picture on transmission. And that's actually something the World Health Organization have come out and said repeatedly. We don't yet know enough about transmission to say this is valid, that, if you board a plane without quarantining because you've had a vaccine, we don't know for sure that will mean you don't bring cases into that country or return home with a new mutation. We don't know that yet. So I think it's just worth saying there's this kind of, where are we on the science? Where are we? What's the bedrock? Because if you build any tech on that, then, you're starting on shaky foundations. Of course, that's going to evolve. So then we were really, I think, interested. We explored the kind of tech, but I think where the group ended up with some of the biggest risks are the socio-technical system, not just the tech, right? You can actually do some incredibly privacy preserving and thoughtful things in the tech build, but that could still generate harms. And there's a few different circles of harm, I guess, that really need probing or risks. So one is just at the individual level, right? Where might this data go and how might it be used? Where might it flow? What are the potentials for scope creep? So even, as I said, the most privacy preserving technologies, the expectation is this is going to be viewed by multiple different actors, right? People in bars, restaurants, border control, police maybe, employers maybe. So, insurance companies, for example, what is this going to mean for insurance premiums? What's this going to mean for employability? And also, where's that scope creep question? Is this going to be used for law enforcement? Is this going to be used for migration, for example? And there was real concern, and we've seen this happen in other places and with other technologies. You start with quite a kind of narrow scope that maybe is very focused on the health, but it might expand to other areas. So that's one risk. I think the next bundle of risks was the risks around society. So how might a tool like this interact with existing inequalities in different countries? Are some groups going to be put at disadvantage because of their access to health, because of their access to technology, or, because of status, because of stigma or discrimination? And, all countries are going to have groups that perhaps face over surveillance already. How is that going to interact with that? And that's something every country is going to have to think about, their own kind of contextual social issues. And again, I think the experts really, they were thinking, what are the risks today? But also, what if this is an enduring piece of technology? What if this is used by future governments? What is this used for future purposes? How might that pose risks? And can those risks be managed, I suppose? And then the third layer really goes to like Alice's really great points on the kind of what does this do then at a global level? So inequalities might be mirrored, they might be amplified. You know, we've seen huge inequalities of access to the vaccine, huge inequalities of access to tests, and we should really care about the ending of vaccine nationalism. You know, what if in the UK you have to have had your most, you know, we get to a point where we have really good vaccination coverage even in a few months, but you need to have always had the latest booster to go on holiday or to go to the pub. Is that going to mean that across the next year we are less generous with the access to vaccines that we have? And you know, the UK is a company that's actually not a company, a country that's actually going very quickly through vaccinating its population. So I think that, you know, just goes to some of those earlier points. We can't just look at this at a kind of small technical and kind of local question. We really have to think about the ramifications. And I think that question of this is a collective problem, the pandemic, and what you're looking at with this technology is an individual solution, right? It's trying to say I can go all the way down to an individual person, risk score that individual person, and have rights or freedoms for that individual level, rather than thinking at a group level, at a community level, at a country level, or even at a global level. So those were just some of the risks that felt had to be really front and center in any country's decision making about whether to let these tools roll out.
Mm-hmm.
Yeah, Alice, I don't know if you want to chime in, but
yeah. Thank you so much, Imogen. In fact, one of the things that I love the study and what it's some of the issues that it's brought up. And one of the questions I have is, do we really, really know the extent of the problem that this so-called immunity passports are going to be solving? Because do we really have the rationale or the scientific validity that to really say we understand the question the passports are going to be? Is it? I think it's premature to start designing a system, any system, without really understanding immunity. And I don't think we understand COVID immunity yet. I don't even, I think, Imogen, correct me if I'm wrong, I don't think anybody out there has actually said, okay, we understand, how immunity works within, especially the COVID context. Is that
correct? I'm no immunologist, but yeah, as far as I know, and defaulting to the experts and World Health Organization, there's, in terms of generalizability, duration, and transmission, those feel like the really big kind of not yet knowns. And then the other thing, I think one of the biggest challenge we have facing the vaccinated population is mutations, right? And mutations you only stop when the world is, no one's safe until everyone's safe, right? So I think those questions are really live, and I suppose we need to be mindful of those, but I guess also look forward to, every day or every week, the evidence keeps evolving. So it's also right to think, what is a scenario when or if you reach these points? But I would love it if governments set a really high scientific threshold before you could move forwards at all, that said, look, you have to know how this interacts with other public health measures as well. Is this going to have a net positive or a net negative effect? Is this really going to keep people safe? Is this going to make people overestimate their safety and actually undermine other measures they should be taking? Could this trigger more risky behavior? All of those questions, I think, really have to be answered almost like first and foremost before you start moving ahead with the technology. We need to know whether the science is there.
Yeah. We're having a dialogue right now, but I want to get a little bit of debate. I want to play devil's advocate, and I'm afraid to, because I know Twitter might come for me, but I'm just going to throw a question out there and be devil's advocate. What I think devil's advocate would say, but this could save lives. What do we say to that? Like, how do we feel about that? I mean, Imogen, you mentioned what's tough about this whole pandemic is this idea that we're learning as we go, and evidence is kind of changing on the fly. And what's extra tough about that is, as we learn more, it kind of gives people who are naysayers fodder to be like, oh, well, you said this before, and now you're saying this. I just don't want to hear it. That's the tough part. But yeah, what do you say to people who say, but this could save lives? Isn't saving lives more important than a person's privacy? What do we say to that?
Well, I think that's partly why when we were looking at this issue, we weren't starting from the point of privacy, right? I think privacy is really important, but I think at the moment, and this really bears out some of the work we've done with publics around this as well, one of the things they want to know is, does it work? Can I trust it? And privacy is a bit of that, but it's not everything. And so I suppose there's a few different bits to the problem. I definitely wouldn't say it's privacy versus saving lives. I don't think that would ever stand up, and you'd never persuade anyone, right? People would pick saving lives every time, quite rightly. I think what we need to do is just track back and say, but what is the specific problem this is seeking to solve? Or what is the actual purpose in this country's context with, its vaccination status, its vaccine hesitancy groups, its access to vaccines, its testing, all of that mixture, its economy, how much it relies on tourism, all these other factors. Looking at that, what is the problem? Like, one problem that I think people would feel very sympathetic to, for example, might be, I want healthcare workers that work with high-risk individuals to have a vaccine. If it diminishes their risk or health service, we have something called a green book. We have guidance, and actually we have obligations for some healthcare workers to have certain vaccines to do certain jobs. So, if that's the problem, do you need a new digital infrastructure that links health status and IDs, or could that problem be solved in a different way? And I'm not saying that vaccine passports can never be the answer. I just think there's, it's been such an amorphous debate, and countries see this as different, it's a tool that can solve lots of different problems potentially, but we really need to nail down, like, what is the purpose? What is the justification? And if that's really crystal clear, I think that then allows civil rights organizations, it allows public health experts, it allows publics to say, okay, is that justified? Is that justifiable? Is it legal? Is it proportionate? You can really then grapple with it. But at the moment, if you set it up as new technology might save lives in this really general way, I think it's really hard to assess and to know whether or not it is, or you're achieving what you need. Or more importantly, is there another way you can achieve the same with fewer risks? So I'm not saying any of the risks that we identified may not be surmountable or may not be justifiable, but you should really start with any other route that you have that doesn't pose those risks, right? Let's start with something, what structures do you have already that might help you do that? Is this the best tool to solve a specific problem? That's, I suppose,
Yeah. Alice Pamad, there's someone out there saying, but this could save lives. What do you say to them?
Well, it's a tough question. The thing is, like, it depends on the country's context. So there are some countries, so what you have to ask first is, what are you trying to achieve by having this vaccination certificate? And how are you going to apply it in your country's context? So there are two main use cases. Like, is it just going to be this border control, like you're traveling out of the country or someone tries to come in? Or is it for the domestic use, like you want to control people who enter a restaurant, hotel, pub, things like that? So like most of the countries who are really depending on things like why they just want to implement something like this. So if you want to do that, one other thing that we have not really addressed as yet is like, how are we going to trust whatever this solution that is presented at the border control? If you're talking about that context, like say, for example, an app produced in one country, is the border control or immigration officers or health authorities at the border control, are they going to trust the result? So, this is one point people argue, like justifying use of technology. Like, the traditional paper formats that we have, there is a lot of chances of falsifying. These things can happen. But then again, one thing again highlighted in this WHO recent guideline is like, there has to be some trust framework and a kind of international entity. Who, if you are using this PKI architecture, like you are going to use this public key infrastructure, then like, who is going to be this trust entity? Who's going to collect all these public keys and distribute it to the government? So this is something that has not been that much clear to anyone as yet. So WHO proposes that, it may be one organization who would try to do that, but then again, how are the governments going to respond to it? So that, this is a total gray area that we all will have to think about. But your immediate question, yes, it's very country specific. Some countries, like for example, some developing countries where like the private sector is non-existent when it comes to producing technologies, all their information is with the government, the Ministry of Health. So they might say, okay, for us, if it is, not going to limit us from whatever activities we are doing within the country, but it is just to prevent people, infected people from coming directly into the country, then this is good enough. So I would say it's very country specific.
Yeah, I like that you mentioned about trust framework, and I want to get to that in a second, but I could tell Alice may have wanted to chime in on the devil's advocate. Alice, do you want to speak on that?
Yeah, I just wanted to actually agree with both Imogen and Ina that's a really difficult question. But I tend to think it shouldn't be limited to the national context, because this is an international public health issue that impacts the entire world. So what you do at the national level, and what you do at the international level does impact. I mean, it's we call it a global economy for a reason. And for me, any decision to deploy so-called immunity passports must be really clearly articulate the scope and purpose, and those must be articulated not just in national and primary legislation, but also in international obligations on, for example, data protection, the right to privacy, data protection principles, for example, of fairness and transparency and lawfulness, including purpose specification and minimization, for example, so those are the data protection principles that I think must be considered. And so it shouldn't be just about privacy and security and the technology that's being deployed. And in fact, ask that really important fundamental questions: are these ID systems going to be empowering or exploitative and exclusionary? We have to keep going back to that. We can't just limit it to, oh yeah, we need to reopen the country because we depend on tourism, but then not care about new strains coming up and the mutation and what the impact that's having on the local population and the local economy. So those considerations, the harms and threats, and must be taken into all of those considerations must be taken seriously.
Can I just add one, add to that? I agree with, I know you want us to be more debatey and disagree, but I agree with everything.
No. We don't have to debate and disagree, but we just have to have a dialogue.
I think there's also another dimension we should think about, which is, I'm sure there's very few countries that would have accepted contact tracing or might accept vaccine passports in normal life, whatever normal life means. And I think we need to really think hard about justification in terms of in the face of an emergency, in the face of a pandemic, right? We've all accepted, the UK's basically been in lockdown now for 4 months. We've accepted curtailing rights and freedoms in a way we never usually would. And we've done that because we could see the justification. But I think when it comes to technology, one of the risks is that it can be introduced for an emergency and a really good reason for an emergency, but it hangs around longer than a scrappy piece of paper that you've got in your, traveling rucksack or whatever. And so I think, some of the experts that we talked to, they talked about the kind of 9/11 security infrastructure or the kind of spread of Aadhaar systems in India. They were thinking, if we get to a point where we think we know enough about transmission, this is a really good way to understand risk. Let's introduce, it's hard, but let's introduce it. The World Health Organization is going to back it. Then I think we also really need to think, what's our off-ramp for this? Do we have sunset clauses to dismantle it? Do we know at what point what's our success measures to say, we wouldn't put up with this if it comes to flu or flu jabs. So at what point do we say that was intrusive, but it was justified? But now we're no longer in a crisis period. Can we pull back from that, or does that then become the new normal? And I think that's just something that you need to think about from a tech perspective, but also a kind of social policy, legal infrastructure perspective as well. Is this ushering in a kind of new normal? And if it is, have we really thought that through? Have we thought that through adequately? Have we engaged with publics about that? Have we really weighed that up and how that's going to shape societies? So I just add that kind of temporal dimension as well. What does this look like in 1 year, 5 years, 10 years? And if it is just a crisis measure, we have to be able to switch it off again.
Yeah. And actually agreeing with Imogen, when you think about how governments tend to use, national public security as an excuse for anything, when you look back at 9/11 and all the measures that were put in place that are still in existence till today, that actually, gave to the surveillance economy that we see, I think that is the frightening bit that we are talking about in terms of, disempowerment and exclusion and extending the surveillance, economy that is worrying.
Yeah, no, you're right. I mean, it's just like classic internet. Like we've seen it so many times where you can't put that toothpaste back in the tube. Like once it's out, it's out. I think, and the other dangerous thing there, going off of that point, is it kind of sets a precedent. It's like, well, you were cool with it back then, so what's the big deal now? You were fine with it back here.
Yeah.
So going off of what Ma was talking about with the trust framework, are there ways that something like a passport could be issued that we could trust, and also that doesn't tier society in a way that we're not comfortable with? How do we achieve the effects of a passport and keep people safe without splintering society, without opening up society to privacy problems? Is that possible? Do we know any ways? It's a tough question. I don't blame you for not knowing the answer right here, right now, but does anything come to mind?
Maybe Imogen and Alice can contribute. So the thing is, like, the answer to this is like, this is not a technology solution, right? So there are two pieces around this thing. So one is the technical specifications, and the other thing is the governance mechanisms. So like about the trust issue, like I mean, the recommendations which exist now, what it suggests is like, if you use this kind of, like if you're using a technological solution like PKI, like all these public keys which are issued by the governments, there has to be some central entity, or I mean, it could even be regional, like which establishes trust framework. Then again, it's a technical specification plus the governance. Like the governments will have to agree. Like governments, like they may agree. Like, yeah, for border control it's okay, but like, are you just going to limit my citizen from roaming around your country? I mean, then that's again a different issue. Like some governments may not agree. So it's always like, I mean, like you have to have the governance mechanisms also. So this is not just a techie solution, and that's what we have to think about. Then about the privacy component, again, it's about like, I mean, who's having the data? So there is, I mean, you have to establish the proper technical solution so that the data is secured. And again, there is some governance part of it. Like there has to be discussions around like who will be collecting data, where is it stored, and what is the minimal data. So even this WHO document suggests that there has to be a minimal data set if you are using it for vaccination certificate, which only lets, I mean, like say you are collecting identity and health status, and this should be minimal. I mean, you should not collect the entire medical record of a person, right? So that has to be agreed upon. And this is where, like, I mean, if you use open standards and standards across the countries, it will be really worthwhile. Say, for example, for developing countries, it will be very difficult for them to establish a proper mechanisms. I mean, proper governance mechanisms around like this data privacy and the minimal data sets. So this is where, I mean, like, there has to be some international entity, a technical entity who can really recommend these specifications, right? Because some countries, they really need it. Otherwise, it will be a very tough task for them. So I will just stop here.
Yeah, no, what comes to mind is, back at MozFest, we had one panel that talked about these like sovereign digital wallets, which were enabled patients to share information with their doctors only for 30 days. And it kind of reminds me of what Imogen was talking about, how like the permanence of these things once we kind of set the precedent. Imogen, is that something that would appeal to you, where if the data was promised to self-destruct after a certain amount of time, if Snapchat was the one making these COVID passports and it lasts a day, are we cool with that?
Wow, one of the things we didn't look at was Snapchat and disappearing messages as the way to do this, but it's good. It's a great question. I think it goes right. There are principles of data minimization. There's actually some really incredibly thoughtful work going on by companies, but also by collectives that have formed around this, that are, some of them even saying, I'm not totally convinced it should happen, but if it's going to happen, then let's make sure the tech has the right principles around it, interoperable, it has the right standards and so forth. So, examples, for example, if you only marry the identity information with the health record locally on a phone rather than creating new data sets. That might minimize some risks. If there's the outputs as well, if you have an app and it only displays a green tick rather than my name, my data, or a QR code, rather than my name, my date of birth, the specific vaccine I had, or maybe I didn't have a vaccine because I'm immunocompromised, but I don't want to disclose that. So therefore I have to disclose a test instead, all these other points. If all it does is a green tick that lasts for a few seconds at an access point, you could see that there are better and worse ways to do this, or ways you can minimize risks. But I suppose I just go back to that thing of, we can't just think about the tech, we think about the whole system. And the whole system goes from jab to border control. And at every actor and at every point, and there are different design choices, there are different risks that kind of come into focus and move out of focus. So that's why I think, if I were in charge, yes, you'd want to get the tech right, but I would really, it's the governance, not just of the technology, but of the society that goes around it. So what are the regulations? What are the laws? What's the policy infrastructure? What are the operational overheads to mean that if you're saying people won't, that can't have the vaccine aren't going to be locked out of society because you've got tests, does that mean you have enough testing facilities? You can turn those round adequately? How does that work for people that don't want to access the test? You've got to think all this stuff through. And if it means that some groups, like in the UK, young people, the vaccine's going down the age groups, if that means people are going to be locked out of employment, for example, is there going to be benefit systems around that? Or are there going to be new employment protections that are needed that said, if someone's pregnant and can't get the vaccine and come into work, is their job going to be protected? There's so much infrastructure around this that would have to be got right. And the tech is one bit of that. But there's a lot else that I think, if governments are going to do this, and if governments are going to do this well, they've got a lot of kind of political overhead to work through. They've got a really big and a really tough to-do list, I think.
Yeah. Yeah, I want to get into final takeaways. I hope the goal is to keep everyone safe, and to do that, we would want to achieve herd immunity. How do we properly achieve herd immunity and keep everyone safe? And what's like a final takeaway you want to leave with viewers today? We'll start with Dr. Ahmad.
So achieving herd immunity is a very tough task. Right? Either you have to get everyone infected, or everyone has to be immunized. Like not everyone, at least a significant proportion of the society, so that the vaccine, the virus can't propagate or transmit. But to do this, that is one part of it. That's a health part of it, to keeping your people safe. But then again, you also have to get your economy running. People need to survive, right? Even during the lockdown period, especially in the countries with poor economies, they can't sustain. So much of tough time. When you are having a couple of months of lockdown. So to do that, you need to have some controls. You have to have some public health measures to keep track of what are the numbers of the infected people. And at the same time, you are trying to roll out your vaccination campaigns. You have to keep track of that. And then again, to get the economies running, you have to let people move around. And also, some countries, they have to let other people come into the country. So what I feel is you need to have some measures in place. But then again, it really depends on it's at country level, right? Some countries might feel we are not just ready. We don't have the necessary the policies and governance. The thing is there is too much risk in trying to implement something like this, because we won't be able to ensure the privacy that we are thinking of, because data can get the private sector can get hold of all this data, right? And the government will not be able to ensure this. But at the same time, some countries may think we have all our data within our government sector, and maybe our government will be able to protect the data to some extent. And at the same time, we have to open up our borders for tourism, right? And also going back to what I said before, it's all about why we are implementing this vaccine certificate. Is it just for people to travel, or it's just for domestic use? So that again has to be considered. So what I would say is it's very country specific. But before any country trying to implement these kind of solutions, there had to be a thorough discussions, and there has to be some consensus, at least with the stakeholders, not just the health ministry or the defense. So, I mean, there has to be like opinions obtained from civil society to make it better. I mean, ultimately, countries might at least put some checks in the way that they are going to implement. So I guess that would be the best way of, going around implementing vaccination certificates.
Got it. Imogen, how do we make it out of this thing, keep everybody alive, not upend society while we do it?
Nice, easy closing question. Thanks. Yeah. Okay, so I think how would I start? First, I think let's split off international travel and generalized domestic use. I think they're two different things, and I think they have different justifications, risks, and overheads. I think the World Health Organization are thinking hard about whether vaccine passports are legitimate in the same way they've looked at other diseases and other vaccinations. I think that the international travel question, we should be deferring to the World Health Organization, and they will be best placed to think about those things like transmission risk and where the science is. For the domestic use, if I were a government, what would I do? I think I'd start, as I said, with what is the problem I'm trying to solve? What is the health particular problem that I'm wrestling with that I can't manage? And I think that needs to be articulated really clearly. And it might be related to something like a vaccine passport scheme, interact with employment law, interact with data information, GDPR, but data legislation. How might it interact with health and safety or human rights legislation? What are going to be the pain points that we need to think hard about? And let's say you pass that next test and you think, okay, I think there is this valid use case or one or more use cases in the country. Then I think you look at the existing structures. And if you get to the point where you think I need to build the tech tool, at that point, I think engaging with, publics around this, really understanding how is this going to affect different communities? How is this going to affect people? Is this going to boost uptake of the vaccine, or is this going to make people think it's mandatory vaccination by the back door? You really need to tease out some of those questions to feel really confident that this is going to be a socially beneficial, tool. And then around that, I think when you've identified those risks, that's when you've got to come up with your whole legislation policy ecosystem around this to make sure that it's not harmful. And then part of that last piece in the puzzle is, what are your sunset clauses? How is this, if this is time limited, if it is specific, it has a clear purpose, it has, really privacy preserving technological build, you figured out how you're going to mitigate those risks, you put it to the public, and how do we dismantle the technology and also the data around that technology. And I'm not saying that's an impossible pathway. I just think it's a pathway we should tread carefully. And I think it's right that the bar is high at each of those points to think, can I proceed with this?
Yeah, it's leaving us a lot to do at the tail end of this and for the rest of time, basically. Alice.
But I think to reemphasize that we really actually need to understand what problem are we solving with vaccine passports, and why is there such a huge rush to implement digital vaccine passports? And I'm emphasizing digital here. Why the rush? And if we're going to be designing and implementing and operating digital ID systems, then in this case, all stakeholders, and especially government, must then make a series of technical and policy choices. And it is these choices that are largely going to determine whether that system will be studying the digital ID landscape. We did a study in India and in Kenya, and we came up with a series of recommendations that are based on, from that perspective, like, openness in multiplicity of choices, where you really need to have, a digital ID, a COVID ID certificate embedded on my phone. What if I don't have a smartphone? How else can I present my vaccination status? Do I really, for example, one of the questions we didn't really cover is, what if there's a trust deficit that exists between citizens and their government? So it's not so much about the technology. What if I don't trust centralized database? Why should I trust that is going to be secure and that, my private information is going to be kept private? And then we also propose accountability here, openness as in accountability. Who are these organizations that are going to be implementing these tech solutions? Who are they? Where is the profit? How are they making their profit? So that we know, what their skin in the game is in terms of just rollout of not just the COVID vaccines, but the digital ID generally. And then openness as in inclusion. To what extent are these digital IDs, digital vaccine IDs, IDs are going to be excluding people, are going to be reinforced? And then the huge issue about if there exists a trust deficit between government and citizens, to what extent are we allowing citizens to actually participate in that discussion around whether or not we need COVID vaccine passports in the first place? And if we do, what are the technical solutions, and who is deploying those technical solutions? So the public participation is also super important in this case. Thank you.
Yeah, no, this pandemic has really unearthed these deep-rooted problems. It tells us what we need to know in advance of the next pandemic. Just kidding. I hope we never have another pandemic. Okay, that is Alice is like, no, we better not. That's our show. We're going to wrap up now. You can catch more content like this at foundation.mozilla.org. Thank you for tuning in on Twitter, on YouTube. Keep an eye on our social media at Mozilla, Twitter, Instagram, where we announce future dialogues and debates and panels and post other fun things. After this, make sure to tune into The Future is Intersectional Black Women Interrogating Technology. It's going to be a really good one. You can find the link at the top of our Twitter page at Mozilla, like I mentioned before. Special thanks to Audrey Hingle, John Lloyd, Mark Walsh, Andy, our fantastic panelists. You all, thank you for joining me again. This was a great discussion, great dialogue. I'm Xavier Harding. I hope you all wear a mask and take care.
Thank you, Xavier.